Today, the topic for discussion is morphological development of craniofacial structures. Now, since the topic is a bit vast, it's been divided into following subcategories. I'll be discussing this vast topic, that is morphological development of craniofacial structures, into methods of bone growth, prenatal growth and development of craniofacial structures, postnatal growth and development of craniofacial structures, and development of dental arches and occlusion. First, coming to what are the various methods of bone growth. Before going into what are the various methods of bone growth, let us first know what exactly bone is. Bone is a calcified tissue. Like our body is composed of various types of tissue. It can be muscular tissue, vascular tissue, neural tissue. Likewise, bone is a calcified tissue that forms the main framework of our body. That means that it provides the main skeletal framework of the body and provides various points for muscle attachment. Now, this bone actually grows by three main mechanisms. It is bone remodeling, second cortical drift, and third is displacement. Remember, bone grows by the three main mechanisms: bone remodeling, cortical drift, and displacement. What exactly is bone remodeling? Bone remodeling is nothing but a combination of two phenomena. First is bone deposition, second is bone resorption. In the figure we can see that bone deposition takes place, and then plus sign indicates bone deposition, negative sign indicates bone resorption. As this bone deposition and bone resorption continues, it results in bone remodeling. Next is cortical drift. Drift is nothing but movement, drifting of the bone. Movement or the drifting of the bone towards the site of bone deposition is nothing but called as cortical drift. When this deposition, resorption continues simultaneously, the thickness of the bone is maintained. But when deposition surpass or is more when compared to resorption, the thickness of the bone or the width of the bone increases. The third main mechanism is nothing but displacement. Displacement in simple terms nothing but means movement of a bone from one particular point to another point. This displacement is being divided into two subcategories. It can be a primary displacement, it can be secondary displacement. What exactly is primary displacement? See, primary displacement is nothing but movement or the displacement of the bone because of the growth within the bone itself. Like for example, let us take an example, nasomaxillary complex. If nasomaxillary complex, if the growth or the bone deposition takes place within the maxillary tuberosity, it causes the entire nasomaxillary complex to be moved in a downward and forward direction. This is called as primary displacement. Now, what is secondary displacement? Secondary displacement is nothing but movement or the displacement of the bone because of the growth occurring in some other bone. Like nasomaxillary complex is attached to the cranial base by means of a number of sutures. When there is growth of the cranial base, these forces gets transmitted to the nasomaxillary complex by means of these sutures, and the entire nasomaxillary complex gets moved in a downward and forward direction. So we have seen that bone grows by three main mechanisms: bone remodeling, cortical drift, and displacement. Remodeling is nothing but deposition, resorption. Continuous phenomena of bone deposition, resorption results in various changes in the bone shape, form, etc. Second is cortical drift. It is nothing but drifting of the bone towards the site of bone deposition. The third is nothing but displacement, which is again divided into two subcategories: primary displacement, secondary displacement. Primary displacement because of the growth within the bone itself, like whenever there is deposition in the maxillary tuberosity, it causes the entire nasomaxillary complex to be moved in a downward and forward direction. Secondary displacement is nothing but growth is occurring at some other bone and is pushing this bone, like bone deposition is occurring at the cranial base. Because of that, forces gets transmitted through the sutures to the nasomaxillary complex, and it causes, see, the entire nasomaxillary complex to move in a downward and forward direction. Now coming to next topic, which is prenatal growth and development of craniofacial structures. See, prenatal life is broadly divided into three main periods: period of ovum, period of embryo, and period of fetus. Now, what is period of ovum? Period of ovum actually runs from conception till 7 to 8 days. During this period, that is period of ovum, that is from conception to 7 to 8 days, sperm fertilizes egg and results in the formation of zygote. This zygote divides a number of times and results in production of a ball of cells, which is nothing but called as morula. The cells within this morula move against each other and results in the production of a hollow ball of cells, which is nothing but called as blastocyst. This blastocyst implant itself to the uterine wall. Next comes period of embryo. The period of embryo is divided into three main categories. It is pre-somite, somite, and post-somite period. First is period of ovum, second is period of embryo. Period of embryo is again divided into three periods: pre-somite, somite and post-somite period. Pre-somite period from 8 to 21 days, 21st day. Somite period 21st to 31st day, and post-somite period is from 4 to 8 weeks. Now what happens during the pre-somite period? That is from 8 to 21st day. Pre-somite period is characterized by the formation of fetal membrane, amnion, chorion, which provides the main nutritional support to the developing embryo. It is also characterized by the formation of primary germ layers. Now what is this exactly, primary germ layers? Primary germ layer is nothing but some of the cells in the inner cell mass of the blastocyst become flattened. They are nothing but called as endoderm, which is the first primary germ layer to be formed. The remaining cells becomes columnar and they results in the formation of the ectoderm. Next, coming to somite period, which is from 21st to 31st day of intrauterine life. This is characterized by rapid growth of the cranial end of the embryo takes place when compared to the caudal end. It is also characterized, the end of the pre-somite and the beginning of the somite period is characterized by complete establishment and separation of the primary germ layers. This period is also characterized by the formation of pharyngeal arches. In detail, I will be discussing pharyngeal arches in the upcoming slides. Next, coming to the post-somite period, which is nothing but from 4th to 8th week of intrauterine life. All the organs which are produced during the somite period now starts increasing in the size in this post-somite period. It is also characterized by the development of basic maxillary form, mandibular form, formation of tongue and palatal fusion. All these things takes place during this period. Finally, coming to the last, that is nothing but period of fetus. It is the period that runs from 3rd month of intrauterine life till birth, and no production of the formation takes place here. Only there is increase in the size of the fetus takes place. So with this, we have discussed what are the various periods. First is period of ovum, second is period of embryo, third is period of fetus. Period of embryo further divided into pre-somite, somite and post-somite period. Next, let us see what is prenatal embryology of maxilla. That is how maxilla is developed in embryo. By about 4th week of intrauterine life, a prominent bulge develops on the ventral aspect of the foregut. This is nothing but on the ventral aspect of the embryo. I repeat, by about 4th week of intrauterine life, a prominent bulge develops on the ventral aspect of the embryo, which is nothing but called as the forebrain or the forebrain. Just below the forebrain, a shallow depression, which is nothing but called as stomodium, that is the future mouth, is seen. The floor of the stomodium is covered by means of a membrane called as buccopharyngeal membrane. This buccopharyngeal membrane separates oral cavity from that of the foregut. Now, during this 4th month of intrauterine life itself, 5 prominent bulges, which is nothing but called as pharyngeal arches, are seen. These pharyngeal arches are actually seen at the area where future head and neck are going to be developed. Actually, 6 pharyngeal arches develop, but the 5th becomes rudimentary as soon as it is formed, and only 5 pharyngeal arches remains. These pharyngeal arches plays a very important role in the development of various muscles, various nerves, development of bones, and etc. The first pharyngeal arch is called as mandibular arch, and it plays a very important role in the development of nasomaxillary complex. Now, of these 5 arches, each arch have a particular nerve supply, and there are certain muscles which develops from these particular arch. From first arch, which is nothing but the mandibular arch, it is supplied by mandibular division of the trigeminal nerve, and the various muscles which develop from this first arch, which is the mandibular arch, are masseter, temporalis, medial pterygoid, lateral pterygoid, tensor tympani, tensor palati, and anterior velium digastric. The second arch is being given the name hyoid arch, and it is supplied by facial nerve. The various muscles which develop from this second arch includes various muscles of the face, occipitofrontalis muscle, platysma, posterior belly of digastric, and auricular muscles. The third arch is supplied by glossopharyngeal nerve, and the muscle which develops from it is stylopharyngeus. The fourth arch is supplied by superior laryngeal and results in the production of various muscles of pharynx and larynx. And finally, the last arch, which is the sixth arch, it is supplied by recurrent laryngeal and produces various muscles of pharynx and larynx. Next, coming to the first arch and the second arch is characterized by the presence of a cartilage. The name of the first arch cartilage is Meckel's cartilage. The name of the second arch cartilage is the Richard's cartilage. Third arch, fourth arch, and the sixth arch cartilage has not given any specific name. Now, there are certain derivatives of these particular cartilages, like The cartilage of first arch is called as Meckel's cartilage, and the derivatives of Meckel's cartilage are malleus, incus, anterior ligament of Milus, sphenomandibular ligament, and it also lays down a mesh work for the development of mandible. Second arch, cartilage name for the second arch is Richard's cartilage. Remember the derivatives of this cartilage by s to the power of 5, like stapes, styloid process, stylohyoid ligament, superior smaller corner of the body of the hyoid bone, and superior part of the body of the hyoid bone. The third arch is not, the cartilage is not given any specific name, and the derivatives of this includes greater cornu of the body of the hyoid bone and upper part of the body of the hyoid bone. The last is nothing but fourth arch and sixth arch. They help in the production of various muscles or the various cartilages of pharynx, and there is a controversy that these cartilages may even have contributions from fifth arch. Next, let us see how there is the development of frontonasal process. Frontonasal process. The mesoderm covering the developing forebrain shows a downward projection. This is nothing but called as a frontonasal process. That is, the stomodium, which is the primitive mouth, is covered superiorly by means of frontonasal process. This stomodium is also covered on either side below by means of mandibular process. Hence, we can see in this diagram there is stomodium which is covered superiorly by means of frontonasal process. The mandibular arch produces a bud from its dorsal end which is called as the maxillary process. This maxillary process grows ventromediocranial to the main part of the mandibular arch, which is now called as the mandibular process. At this stage, the stomodium is covered superiorly by frontonasal process, on either side by the maxillary process, and below by means of the mandibular process. The ectoderm over the frontonasal process shows bilateral localized thickenings, which is nothing but called as nasal placodes. These nasal placodes, as soon as they form, soon sink and result in the production of nasal pits. Because of this nasal pit, the frontonasal process is divided into two parts, medial nasal process and the lateral nasal process. You can see in this diagram. The mandibular process starts grow towards each other and finally fuses at the midline and results in the production of mandible and the lower lip. As the maxillary process starts growing towards each other, it causes shrinkage of the frontonasal process, and ultimately the two nasal pits come very close to each other. And the fusion of the maxillary process with the medial nasal process is marked by nasolacrimal duct. Next, coming to development of palate. The palate is actually contribution of three things. Primitive palate, actually two parts, primitive palate and secondary palate. Primitive palate is actually a contribution from the frontonasal process, and secondary palate is contribution from maxillary process, and the palatal shell is given out from the maxillary process. By about 7th week of intrauterine life, the palatal shells starts growing towards each other in a medial direction. That means they grow towards each other medially. But because of the presence of the tongue, the movement of the palatal shelf medially towards each other is prevented, and they start growing vertically downwards. And sometimes at around the 7th week of intrauterine life only, there is sudden change or the transformation in the growth of the palatal shelves. That means they were growing vertically downwards. Now they start growing medially towards each other. This change, the transformation, is actually attributed to a number of factors. Like this sudden change in the growth of the palatal shells can be attributed because of the changes in the biochemical and physical consistency of the palatal tissue. It can be because of certain intrinsic force within the palatal tissue. It can occur because of the changes in the vasculature supply of the palatal tissue, or sometimes simply because of the movement of the head, embryonic head, from against the heart prominence causes mouth to get open, and this causes lowering of the tongue. And once the tongue gets lowered, the palatal shells, instead of growing vertically downwards, they now start growing medially towards each other. At about 8th week of intrauterine life, the palatal shells are in close approximation with each other, and fusion takes place once the epithelial cell lining disintegrates and the cells intermingle with each other, and ultimately fusion of the palatal shells takes place. Now this fusion of the palatal shells doesn't take place at the same time in the entire palate, but it starts in the center or the middle and then progresses anteriorly and posteriorly. It doesn't continue most posteriorly, where the palate remains in the form of a soft palate. And one more thing, the palatogenesis begins at about 8th week of intrauterine life, and complete fusion of the mid palatal suture takes about 12 to 18 years. Next is development of maxillary sinus. At about 3rd month of intrauterine life, maxillary sinus development takes place. And actually maxillary sinus is developed by the expansion of the nasal mucosa in the maxillary bone. Once the expansion of nasal mucosa takes place into the maxillary bone, further increase in the size of the maxillary sinus simply takes place by the resorption of the maxillary bone. Now, what is prenatal embryology of mandible? As I have already mentioned that mandibular arch produces a bud from its dorsal end, which is called as the maxillary process. This maxillary process grows ventro-mediocranial to the main part of the arch, which is now referred to as mandibular process. And at this stage, the stomodium is covered superiorly by frontonasal process, on either side by maxillary process, and below by means of mandibular process. The two mandibular processes from both the sides grow towards each other and finally fuses at the midline. This results in the production of the lower jaw and the lower lip. A very important aspect to be studied in the prenatal embryology of mandible is Meckel's cartilage. As I have already mentioned, that the cartilage of the first arch, that is the mandibular arch, is called as the Meckel's cartilage. Meckel's cartilage is actually produced from the first pharyngeal arch during the 41st to 45th day of intrauterine life. It actually runs from cartilaginous otic capsule towards the symphysis and provides the main guideline for development of the mandible. Much of the Meckel's cartilage usually disappears or get ossified during the time of development, but part of it still remains in the form of mental ossicles, malleus, incus, anterior ligament of malleus, sphenomandibular ligament. The first structure to be produced in the primordium of the lower jaw is the mandibular division of the trigeminal nerve. After this, it is followed by the mesenchymal condensation, which results in the production of first branchial arch. Now, because of the neurotrophic factor induced by this nerve, it initiates osteogenesis. Each primary ossification center is present in each half of the mandible during the 5th month of intrauterine life, and this ossification center is present at a point where there is bifurcation of the inferior nerve into mental and incisive branches. From this primary ossification center, now the ossification begins and starts covering the entire nerve, even moves upwards, even moves downwards, and it goes above the nerve and produces trough for accommodating the developing teeth. Now this ossification continues and it stops at a point that is called as mandibular lingula, from where Meckel's cartilage continues into the ear and results in development of various mental ossicles and malleus and incus. Next, coming to endochondral bone formation. Let us first know here, bone formation actually takes place by two mechanisms. It can be intramembranous or it can be endochondral. The difference between intramembranous bone formation and endochondral bone formation is, in intramembranous bone formation, bone is laid down directly from osteoid cells, whereas in case of endochondral bone formation, first it results in the production of cartilage then results in the production of undergoes osteogenesis and then develops bone. So endochondral bone formation is actually seen at three areas of the mandible. It is at condyle, at the coronoid process, and at the mental region. First, let us know about how endochondral bone formation takes place at condyle. At about 5th week of intrauterine life, an area of mesenchymal condensation is seen just above the developing condyle. This soon takes place a shape of a cone-shaped cartilage by about 10th week of intrauterine life, and then undergoes ossification by about 14th week. It finally then migrates and ultimately fuses with that of the developing ramus of the mandible by about 4th month of intrauterine life. Next, coming to coronoid process. 2 or 3 small accessory cartilages appear at the region of the coronoid process by about 10 to 14th week of intrauterine life, and these are actually considered to be developed in response to the developing temporalis muscle. As soon as they form, after that they undergoes ossification, and just before birth they completely gets disappeared within the intramembranous bone of the ramus. The last is mental region. Here also 2 to 3 small cartilages by name mental ossicles appear on either side of the symphysis at about 7th month of intrauterine life, and they soon get embedded within the intramembranous bone of the ramus 1 year after the postnatal life. That means after the birth, postnatal life, after the birth, during that first year, the mental ossicles also gets completely disappear or embedded it in the intramembranous bone. So this was all about prenatal embryology of mandible. Thank you.